Okay, now let us come. What is the drug of choice when you see immunomodulatory drugs? You have got so many immunomodulatory drugs. Now, when we talk about newborns, in the newborns, which is a best immunomodulator, so breast milk itself is a very good immunomodulator, because we know that those babies which are fed with the immunomodulator, that means babies fed with the breast milk, they have got very less incidence of respiratory tract infection. Okay, therefore, baby should be given with the exclusive breastfeeding. That is one of the important issue. And apart from that, certain drugs, if you want to prescribe, we have got Yashtimadu Rasayana. Yashtimadu is a very good Rasayana. Similarly, Guduchi Rasayana is there. So these are all the drugs to take care of immunity of the child. First, your prescription should contain one drug. Okay, either Guduchi Rasayana, should have Vardhamana Pipali Rasayana, that is also very good. Ajamamsa Rasayana, Vasa Guduchadi Rasayana, then Avaleha, Bruhat Chagaladhigrata, Amrita Prashagrata, Chavana Prash Avaleha, Pipalyadhigrat, or Drakshasava. Drakshasava is also very good. Brahmana effect, which can be prescribed in the required doses regularly to enhance the immunological status of the child. This should be there. Okay. Meanwhile, this is first that it should contain an immunological drug. Second thing, see, while explaining the treatment of Kasa, Charaka explains some of the important things. That is, he always says that for Kasa and Shwasa, during the treatment, you can give the medicine in the following forms. So, forms of different administration mode. We can give the medicine in the form of Bhoja or Pana, Sarpi, Leha, Panaka, Kshira, Sarpi Guda, or Dhumapana, etc. So it depends on the physician which form you want to give. So whatever palatable form or whatever form that child likes, you can give the medicine in the above mentioned form. These options are given by Charaka. Frequent administration should be always done in case of Kasa and Shwasa. Shwasa, Kasa, Hikka, Chardi, Muhur, Muhur. So medicine should be given medicine should be given in the Muhur, Muhur. You cannot stick on to either BD dose or TID dose. Of course, you may have to give the medicines every 3 hourly or 4 hourly, 6 hourly, like that. Muhur, Muhur dose of medicine should be given. Of course, medicine should be little. Dose should be calculated, but should be frequently administered. Then meanwhile, he also says a Kasa may lead to Shwasa and Shwasa may lead to Kasa. Okay, they are interrelated. Kasat Shwasa. Suppose Kasasya Roda Tadruddhi Shwaso Aruchir Damaya. So Kasa Roda will lead to Shwasa. And Vagbata also says that Kasa itself, Kasat Bhave Shwasa. So they are totally interrelated. Meanwhile, one more thing is, further we find that there will be vitiation of respiratory mucosa and subsequent pathology in all the cases, whatever may be the cause, irrespective of the cause. Cause may be dust, cold, breeze, virus, bacteria, anything. But ultimately, who is get affected? Which is get affected? It is respiratory mucosa. There will be involvement of the respiratory mucosa. Either there is irritation, either there is inflammation, or either there is excess secretion, whatever may be. So this has to be kept in mind. Similarly, we have to inquire about the Vegadharana habit of the child also, because Vegadharana itself is one of the main cause. So like this, these are some of the facts which has to be kept in mind. Similarly, there is one more important factor has to be kept in mind when you are treating. These are the two important factors which stays true for all type of Kasa. Individual Kasa I will explain later. In all the Kasas, two important treatment is there, and that should be given in all the Kasa. Number one, I already explained, immunological treatment. You have to give one immunological drug, immuno-enhancing drug. Second one is Vatanulomana Chikitsa. Okay, it may be any type of Kasa, any type of Shwasa. Vatanulomana treatment should be there, because if you see the the Samprapti of the Kasa, what Charaka says? Adoho pratihata vayu urdhva shrota samashrita udhana bhavamapanna kante sakto tato vrasi avishya shirasakani sarvani cha pratipurayan abanjan akshipandehe hanumadya tatakshini shushko vasa kafava kasanat kasavuchate. That means the apanavata which is moving in downward direction, due to the causative factors, it attains the upward direction. Udhana bhavamapanna. Apanavata has to move in the downward direction, but it is moving in the upward direction. This is the basic pathology of the Kasa. Therefore, unless and until you correct this direction of Apanvata, unless and until you correct the direction of the Apanvata, the treatment or Samprapti Vigatana is not possible. Therefore, it is quite clear that Vatanulomana Chikitsa should be done. Number one is immunological treatment. Number two is Vatanulomana treatment. Now, how to attain the Vatanulomana? Simple. You can go for Haritaki, or sometimes simple hot water mixed with the Ardraka. That is also sufficient. Sometimes you can give takra with hingu. That is also sufficient. Or sometimes simply give hot water. That is also sufficient. Or if you want to give some other drugs, Agastya, Haritaki, Leha can be given. And locally, Vatanulomana can be done by Abhyanga. Why? You go for Taila Abhyanga, that is also good. Okay, so direction of Apanavata should be corrected first, regularized by some of the Shoto Shodaka drugs like Shunti, Maricha, etc. So once this direction is corrected, half of the symptoms will be reduced. Clinically, what we see, especially what I observed is, so when you add one Vatanulomana drug in any condition of Kasa and Shwasa, 50% of the results will be seen. You can just try it. Okay, 50% of the results you will get when you add one Vatanulomana drug. Okay, these are the two basic prescription contents that you should have. Now let us go for individual treatment of Kasa. That is, treatment of Vataja Kasa. See, Vataja Kasa is a condition where there will be irritation of the respiratory mucosa by different causes. This causes leads to break in the epithelial lining, mucous glands, and also drying effects on the mucosa. This manifests an irritable hacking cough, as there will be counter stimulation of the cough center due to this irritation. And there will be intractable cough will be there. Continuous bouts of cough will be coming because cough center is get irritated because of mucosal irritation. And this leads to irritating cough with less sputum. There is no much formation of the sputum because it is only because of the irritation of the mucosa, and more forceful, vigorous coughing will be there because it is directly affect the cough center. So there will be increased pressure in all over the body, especially in the cavities, etc. So this leads to more and more muscular work. Okay, muscular work will be increased. When you do the more and more coughing, muscular work will be more. So usually what Charaka says and classic says that in case of Vata Kasa, there is Hrut Parshva Kukshior Ruja. There will be pain in the Hrut Parshva because of continuous coughing, irritable coughing. So you will patient cough more, child cough more. Therefore, there will be pain in the chest area, and also because of increased pressure, because of continuous coughing, there will be headache, Shiro Ruja. Okay, so Hrut Kanta, Parshva Ruja, Shiro Ruja. So these are the symptoms explained for Vata Kasa. The reason is same. The patient is totally restless due to continuous bouts of Kasa. Now comes management of such Kasa. What we have to do? It should be done by aiming the Vatahara treatment. So here, see, there is less sputum. There is no formation of the sputum. There is only irritation is there. So this should not be vigorously treated. Here what you have to do is we have to just go for Vatahara treatment. Vata Shamana should be aimed by internal and external administration of the drug. So how to do this? Yes. Internal administration of Madhura Rasa, Vatahara drug should be given. Therefore, we have to go for Madhura Rasa drugs which are having Vatahara in nature are better choice in the form of Yashti Madhu to combat the Vataja Kasa. Yashti Madhu is the drug of choice. You just take it. It's the drug of choice for Vataja Kasa. Same can be achieved by Taila Prayoga like Tila Taila, Irimedadi Taila, etc. as it is Vatahara. Vataja Kasa, which leads to irritation of the mucous membrane, can be reduced by the application of soothing substances having fragrance like Ela, which decreases the irritation. Okay, because the mucosal irritation is there, we should have some soothing effect. Same can be also achieved by achieving the Kadiradivati. Okay, again it is having Madhur Rasa, Kashaya Rasa, so it gives a soothing effect and also Vatahara effect. As we know, Ushna is always Vatahara and Snigdha is also Vatahara. Taila is one such unique substance which is got Ushna Snigdha. Okay, so Taila application. So both these properties are present in Taila, hence it effectively reduces the Vata. So Ushna Ambupana. So Taila is very good. So Taila application can be done. You can go for Abhyanga to the chest area. Okay, that again acts as Vatahara. Or if possible, Taila administration can be also done. Again it is Vatahara. So further, Ushna Ambupana, that is a frequent consumption of the warm water, also renders the function of Vata Shamana, because Ushna is always Vata Shamana. So just give Ushna Pana, Ushna Ambupana. Okay, and also Ushnapana does one more thing, that is, it also Vatanulomana. So Vatanulomana and Vatahara treatment, so both will be achieved by a single Ushnapana if it is possible. Okay, Madhur Rasa drugs can be also provided through the diet or through the milk. For example, Madhur Rasa, it is not compulsory that always drug should be given. Sometimes even the diet can be also given. For example, Haridra with the milk.